Hello everyone. So in this video, we will learn about hip control training, under which there are 4 components. First, hip and knee flexion over the side of bed. Here, the patient will be in supine position at the edge of the plinth and the therapist will be standing besides the patient. Place the leg of the patient over the side of bed with her hip flexed, knee flexed and foot in full dorsiflexion. Guide the leg up to the bed and back while she actively assists. Repeat the movement, preventing any abnormal pattern. Second, hip control with foot on bed. Here, the patient will be in supine lying position and the therapist will be besides the patient at the foot end of the bed. Place the patient's hip and knee in flexion. Using one hand, keep the foot in full dorsiflexion and other hand has to be placed on the knee. Allow patient to move her knee alternately in medial and lateral rotation smoothly without her other leg moving and without tilting her pelvis. Third, hip control with hip in extension. Here, the patient will be in supine lying position and therapist will be besides the patient at the foot end of the plinth. Place the affected leg of the patient in flexion. Therapist will hold the pelvis of the patient and ask the patient to lift it off the plinth and maintain it while moving the knee out and in. Fourth, stimulating the initial hip extension. Here, the patient will be lying on her sound side and the therapist will be behind the patient. One hand of the therapist has to be on the pelvis. Ask the patient to flex the hip. The other hand of the therapist has to be on the anterior aspect of thigh. Therapist has to initiate the movement so that the patient will go into full extension.